Okay, everybody. Hello and Happy New Year. This is Dr. Jennifer Gardella, and I am on with the lovely Kimberly Permar of BCHIP. Kim, am I saying your last name right?
Yes,
Oh, perfect. Okay. It takes me, as we all know, it takes me a while. So happy 2026, Kim. Are we glad that we're here?
thank you. 100%. Absolutely. Yes. Happy New Year to you and very happy to be here today.
Awesome. So we have two big things to talk about today. We're going to talk about vaccines and your smoking cessation program. Why don't you pick which one we do first?
Sure. Well, we'll talk about smoking cessation first. That would be
Awesome.
fine.
Great. So tell us, I mean, let's face it, a lot of people in the new year do make those New Year's resolutions. My husband joined a gym. It's endless fun, endless fodder in this house about what stage we're at. Are we at the buying of the shoes or buying of the sweatpants stage? We still have not been there. But anyway, so a lot of people decide to give up smoking in the new year.
Mhm.
And I love what your team usually says. This does not have to be an all or nothing, smoke out. So why don't you go ahead and explain a little bit about the program and how they get involved?
Well, I think it's really important that people realize that, first of all, to your point, it doesn't have to be all or nothing. Just learning the skills about how to smoke less and decrease what you're currently smoking is important. But the other thing that I think a lot of the folks that I know that smoke think, oh, I've been smoking so many years, why quit now? And I think people don't realize the immediate benefits of when they stop smoking and how it really does still have an impact on their health. And so, for instance, as we get older, myself included, and you're having different health conditions, if something breaks or, you have cuts or, you're just doing a simple chore, cut your hand opening up a jar or something silly, you don't heal as well when you're smoking.
Huh.
And so, just little things like that that people don't realize. If you need any kind of surgery, you don't heal as well. You don't recover as well if you are a smoker. So when if you decide you want to stop smoking, no matter how old or how many years you've been smoking, it certainly has an impact on your health the minute that you stop moving forward. And so, yeah, that's important for folks to know.
Okay, that is critical.
Yeah.
Go ahead. Sorry, I interrupted. I'm dumbfounded. I've never heard that one.
No, so that's okay. So we really want to encourage folks that if you're at all thinking about quitting this time of year, BCHIP does have our free classes throughout Bucks County. There are some live sessions throughout the county where you come for 5 sessions. It's about an hour to an hour and a half, depending on the size of the group. And the reason that we recommend a class is because it's hard to do this alone. I mean, nicotine is very addictive. We know that. And what I like about the classes is the people that lead them, we call them facilitators here at BCHIP. And that's because they're not really designed to be teachers. Although they do some teaching, they're designed to facilitate the group so that the group can find solutions that work for them. And what I like is when you come to these classes, whether they're live or virtual, you learn from others. Some folks are coming to a class for the second, third, or even fourth time to share their successes or their failures or what worked or what didn't work. So you learn from other people. You get the support you need because what I learned as a smoking cessation instructor is that it is really an emotional thing to quit smoking. And so just having someone else to kind of commiserate or share those experiences with and realize you're not in it alone, that is what you're feeling is so normal, I think is helpful. And then, of course, yes, the facilitators give resources about here's what to expect if you do quit on day one, on week one, on week two. And the facilitators can kind of coach everybody along as they do that.
Okay, fabulous. And again, this is free. It's a free service of BCHIP. Are you offering Zoom sessions this quarter or just in
We
person?
we are. So we have both Zoom and live. And then it's important for folks to know too that we always have the free nicotine replacement therapy as well. So whether that's gum, lozenges, or patches. And we have different doses of those to kind of help folks for those that want it. It's not required. You don't have to use it, but should you want to use that as a tool in your toolkit when you're quitting, we have that available for folks as well.
And do they have to be in the class to get the nicotine replacement therapy?
They do.
Okay,
They
good to
do. They
know.
have to
You need
participate
that
in the
support
class.
behind you so you have success.
Yes,
Who doesn't
correct.
like a good support group? Come on.
So if anyone's interested in registering, you can go right on our website at bchip.org to register for the classes, or you can always call our main number, which I never remember when I'm on here. God, it's terrible. 267-291-7882. And when you listen to the prompt, you'll be prompted into the tobacco cessation program. So it is completely free. We encourage folks to participate. If you want to, you can bring a buddy, which is always helpful. If
Oh,
you are a friend or somebody wants to quit together, we find folks to be pretty successful with that too. So that's how you
awesome.
could register if you want to participate.
Okay, fabulous. So if anyone has any questions, you can also visit the BCHIP website for more info. Phone number, Kim, obviously demonstrating your ability to find resources quickly. Even your own phone number, you know exactly where to find it. So we highly recommend the program. It's free, including the nicotine replacement therapy, also just known as the gum or the patch. So good stuff. And then we also wanted to remind folks of something important, and I do have questions about this, but go ahead. Why don't you introduce the second topic?
So, if you watch the news, it hasn't been a friendly flu season. And we know that there's so many myths and so much hesitation around vaccine, a lot of that being created by misinformation that has just been shared in so many different places. But what we do know is that it is still important to get a flu vaccine. And BCHIP has those resources available for folks that are homebound and need flu vaccines. So if you're homebound and you need a flu vaccine or a COVID vaccine, we will come out to your home and we will get that for you. We'll get you scheduled. If you are not homebound, but you are looking for a location to get a vaccine, you can still call us. We can connect you with lots of local resources. We partner with a few local pharmacies, including Giant Pharmacy. We also have some private funding by CNN Bank, as well as from the Foundation Community Partnership for folks who are under or uninsured. That should somebody really want to get a vaccine and not be able to, they can reach out to us and we'll try to find them a location that we can work with to make sure there are funds available for them to get the vaccine.
Fantastic. Okay, so I have a question. You ready? So, if we're in the middle of cold and flu season, let's just call it flu season, and I get a vaccine now, is it too late?
No, it is not because it is still spreading. And so it is not too late at all. And that's really the purpose of me wanting to talk to you about it today. We know it can still be effective and can help. Remember, a flu vaccine is similar to a COVID vaccine in that it doesn't necessarily always prevent you from getting the flu entirely. But if you
Oh,
get
right.
the flu, we know that you will have typically less severe symptoms. And so again, it's not a vaccine like the measles and mumps and polio vaccines where you typically don't get those diseases at all if you're vaccinated. You
Right.
may get the flu, but it will decrease typically the severity of your symptoms. And for anybody who has any kind of health conditions like COPD or any kind of respiratory condition, particularly, or any other health item that puts you at risk, it's just really important to get that vaccine.
Sure, absolutely. Okay, so again, go to your healthcare practitioner. You can call BCHIP if you need services such as you're homebound and you'd like more information. But please go and get your flu vaccine if you have not done that yet. Okay, so two important things at the beginning of the year. One, everybody, let's make a commitment to stop or reduce the amount we are smoking. And
Or vaping, and we didn't talk about that.
oh, is vaping included in the program?
Yes, it's the whole program is about decreasing nicotine intake. So while it focuses on smoking, while we were all sleeping in the public health world, the tobacco industry came out saying that vaping is safer and vaping is healthier and vaping is cooler, and none of those things are true. And so it also is very addictive. And so the tobacco industry has been very successful at getting an entirely new generation of people addicted to nicotine. And so the class focuses on smoking, but withdrawal of nicotine and that symptom management is the same. So yes, people who are trying to stop vaping can certainly participate in the classes as well.
Wow. Okay. See, people, you learn something new. You got to tune in every couple weeks with Kim and all the great information she has on making us healthier here. Kim, thank you. And we'll see your team. Someone from your team is here with me once a month or every other week. And so, everybody, call the BCHIP line when you need resources for important healthcare decisions.
Yes. We're looking
Okay.
forward to a happy and healthy 2026.
See you next time.